Assalamu alaikum, everybody. Good morning, good afternoon, or good evening, depending where you are. Welcome to the opening session of the new edition of our summer school on vaccination ethics. A great pleasure to have this new edition in the midst of the difficult times of the COVID-19 pandemic. Despite all the difficulties, we could have this galaxy of speakers coming together. We hope it will be beneficial for everyone. This summer school is a follow-up of the previous CILE summer school on ethics of pandemics and COVID-19, which was held last August 2020. And it was clear when we were having the school last year and by the advance of time that vaccination ethics will be a front page issue in the coming weeks and months, and this is what happened. So we believe it's a good choice to focus on vaccination ethics from an interdisciplinary perspective. As you see in the program, we will have perspectives from inside the Islamic tradition and different disciplines, also from outside the Islamic tradition, to see how the ethical dilemmas of vaccination can or should be addressed. Our pleasure is doubled this year also because of having important co-organizers together with whom we have worked many times and collaborated before on various events. We have the World Innovative Summit for Health and WISH, and we have Weill Cornell Medicine College here in Qatar. You will hear from them in this opening session, but first we will hear from Dr. Emad Shahin, the Acting Director of the Research Center for Islamic Legislation and Ethics, Acting Director of CILE, and the Dean of our College of Islamic Studies at Hamad bin Khalifa University. Dr. Emad, the floor is yours.
Thank you very much, Dr. Ghaly. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Distinguished speakers, colleagues, and dear attendees, a warm welcome and a very good afternoon. My name is Emad Shahin. I am the Acting Director of the Research Center for Islamic Legislation and Ethics, CILE, as well as the Dean of the Center's home at the College of Islamic Studies at Hamad bin Khalifa University. The summer school, which officially starts today, is one of a series of CILE's thematic summer and winter schools. Each school unravels a current ethics-driven debate that is yet being understood across the region and the world. These schools have delved into theoretical and applied explorations of ethics and Islamic ethics in various topics, including Maqasid al-Sharia, Maslaha in Islamic tradition, the extreme pandemic, and most recently, the ethics of artificial intelligence. The current theme for this summer school is just as contentious: vaccination ethics. The debate has impacted every individual on the planet, and its very nature requires us to break it down and identify the finer ethical nuances of the discussion. Such discussions are part of CILE's broader interest in addressing front-page issues from an academic and scholarly perspectives, and to investigate the layers in the debate in a manner which is accessible to the general public. However, given the complexity of the matter, we are keen to do justice to the topic of vaccination ethics alongside our invaluable partners in this endeavor, Weill Cornell Medicine in Qatar and World Innovation Summit for Health, WISH. I extend my personal congratulations to both Dr. Thurayya Arayssi and Mrs. Sultana Afdhal and their excellent teams for their joint effort in realizing the summer school with CILE. While Cornell and WISH have been critical partners in our mutual networks, and CILE continues to partner with such illustrious minds to contribute to the regional and global discourse on ethics. Lastly, I would like to recommend delving into the rich archives of CILE for further familiarity with the extensive work in ethics that is conducted at the center. Through various mediums, including these seasonal schools, intensive seminars, public lectures, and open access publications, we are driven to keep our critical research output accessible to academic and non-academic audiences, and to continuously inform a wide range of themes and issues from an interdisciplinary perspective. Once again, I extend my gratitude to all my colleagues and organizing partners for holding this essential school, and look forward to the enlightening discussions that will emerge from today's program. Thank you and all the best.
Thank you so much, Dr. Emad. Thank you so much. We move now to Mrs. Sultana Afdhal. She is the CEO of the World Innovative Summit for Health. By the way, the bios of all the speakers in this session and also throughout the summer school, you can find them in the booklet that you all have received. And you can also click their names on the programs, which will bring you to the bios of these speakers. Mrs. Sultana Afdhal is a key figure in collaboration with CILE and with our College of Islamic Studies. And we are very happy and very grateful for their collaboration with us also in this event. Ms. Sultana Afdhal, the floor is yours.
Thank you. Thank you, Dr. Mohammed, Dr. Emad. And yes, the CILE, I agree, we have a great collaboration, and hopefully things, that extensively become bigger and better as time progresses. It is a multifaceted partnership, and I think almost within the world, a niche that we hope to expand and build upon. So, I'll stop there about the partnership, but we'll welcome everybody. So good afternoon, everybody, and welcome to what promises to be a fascinating few days of learning and discussion and critical thinking around the ethics of vaccination. On behalf of everyone at the World Innovation Summit for Health, I'm delighted to play our part in this extremely important event and discourse. So the emergence of COVID-19 has shaken the world. Health systems the world over have scrambled to deal with the virus and its effects. Financial ecosystems have rewritten prudency rulebooks, and individuals have been asked to trade personal freedoms for collective responsibility. And as debates continue to rage across the globe, most acknowledge that the only real way out is through an effective vaccination campaign. Against this backdrop, we have seen unprecedented challenges and remarkable progress. Vaccines that would otherwise have taken years to produce and bring to market were deployed within a year, with scientists, manufacturers, and regulators alike asked to abandon traditional thinking in pursuit of a solution to what history is likely to judge as one of the defining challenges of our time. And now, 18 months since the beginning of the pandemic, we find ourselves again continuing to grapple with questions of deep ethical importance. For example, right now, societies are having to ask themselves whether they should extend vaccinations to those under the age of 16, or in some cases, whether parental consent should be required. And as they do, the World Health Organization warns us that as a global community, vaccine inequity could critically undermine our response. So vast swathes of the world remain unvaccinated, even for those in the most vulnerable groups. And as we are reminded that during a pandemic, nobody is safe until everyone is safe. So with so much to consider, I'm quite sure that the coming days are going to be thought-provoking, challenging, and extremely insightful. I very much look forward to being part of it. Thank you again, CILE.
Thank you so much, Sultana, for being with us, for the collaboration, and for your talk. Now we move to Weill Cornell Medicine College here in Qatar, and Dr. Thurayya Arayssi, again, another important and strategic partner. The Weill Cornell, and especially Dr. Thurayya personally, is among the medical institutions that care a lot about ethics. I have seen this myself, and about Islamic ethics as well. I participated in many of the grand rounds organized by Weill, Cornell, and chaired by Dr. Thurayya. We have made also an intensive training for healthcare professionals on Islamic bioethics, etc. Many things we have done together. Unfortunately, I don't always have the time to respond positively to their invitations, but they are doing great work, and we are very happy and proud to have them partners in this activity, and hopefully things will continue and improve in the future as well. Dr. Thurayya, please.
Good afternoon, everyone, and thank you very much for the invitation and for the collaboration on this very important summer school by the Center for the Islamic Legislation and Ethics. My name is Thurayya Arayssi, and I'm the Vice Dean for Academic and Curricular Affairs at the Weill Cornell Medicine-Qatar. And I'm a physician and a practicing physician here in Qatar for many years. And we've all been struggling through the various aspects of handling whether the clinical manifestations or the ethics around treatment, masking, and now more recently, the vaccination. I was really very thrilled and truly honored to be asked by Dr. Ghaly, who, as you have heard, is a close collaborator and colleague, to present on behalf of my organization in the summer school. You know, this summer school is very important for us at this point in time, because it's going to be very essential to help combat the misinformation around vaccination and the ethics around it, while at the same time, by looking at your schedule, showing respect to all points of view, which is coming up to be very essential at this time in order for all of us, through interdisciplinary work that is happening, to facilitate curtailing this horrible pandemic. Just for some of the participants who don't know about Weill Cornell, my institution was founded in 2001 as an international site of Weill Cornell in New York, and it was the first American university to offer an MD degree abroad. We have graduated more than 450 graduates to date, many of whom are back in the community working as academicians and practicing physicians. Our student body, as well as our faculty, are multinational, and our students do all of their clinical work, as well as our faculty at our affiliate hospitals, whether it's Hamad Medical Corporation, Sidra Medicine, Primary Care Corporation, as well as Aspitar. In addition to providing medical education for undergraduate students, you've heard from Dr. Ghaly that we do provide also very active continuing professional development for the physicians in practice. And this is where there has been a very strong collaboration with HBKU, particularly around the area of biomedical ethics, which we partner very closely with Dr. Ghaly. Another very valuable arm at Weill Cornell is our research. And this year, the work of my colleague, who you are going to be hearing from today, Dr. Laith Abu Raddad, has been very important in helping us understand globally the impact of the pandemic and how to curtail it. I am not going to give you any preview because I believe that Dr. Abu Raddad will be talking about his very impactful studies in the New England Journal and the nature that were actually referred to by major media such as the Washington Post and I believe the New York Times, and Laith will talk more about this. COVID has been horrible. It's a horrible disease that truly, unless, your physician, people really don't underestimate how horrible it has been on the lives of people and communities. It is now responsible for at least 3 million excess deaths. This is only in 2020. And unfortunately, it affects disproportionately vulnerable population. Currently, what we know about vaccinations is that the vaccination rates are varying widely across the globe and favoring more commonly the higher income countries. And the reason for this and the reason for vaccination hesitancy is quite multifactorial. What we know so far, this is a framework that we think about in thinking about vaccination hesitancy, is that vaccination hesitancy is caused by socioeconomic and healthcare inequalities and inequities, structural racism, and previously unethical research involving some ethnic minority groups has playing a role in vaccine hesitancy, barriers to access, including vaccine delivery time, location, and cost, related to inequalities and marginalization is causing a delay in vaccine delivery. Social disadvantages, including lower level of education and poor access to accurate information, has been also another very important aspect. Misinformation, disinformation, rumors, conspiracy theories, in particular through social media, have also been playing, as you all know, a major role. And lack of effective public health messaging or targeting campaigns globally. I think Qatar in particular has been extremely effective in this last point by the way that they have been targeting the public and providing a very effective way of informing and teaching the community about the efficacy of the vaccines. So what are suggested ways now, potential solutions for us as a community to handle and combat this vaccine hesitancy? Is offer a tailored and communication from trusted resources, as we can see that what's happening here in Qatar, improve access to vaccines, improve more the community engagement, and finally training and education of those involved with engagement activities at a local level. And I believe this is one of many strengths of this program that is going to provide training and education that is very relevant to the community here, but also to the region worldwide. I'm going to end here. Thank you again for the invitation, for the collaboration, and I look forward to being engaged in this very innovative summer school, and wish the participant the best of luck. I'm sure you're going to find the summer school to be to help you critically think and help us all engage in combating this horrible pandemic that I hope is going to be beyond us. It's going to get beyond us very soon. Thank you again, Dr. Ghaly, for the kind invitation.
Thank you so much, Dr. Thurayya. Thanks, Mrs. Sultana. Thanks, Dr. Hamad, for your opening talks. Ladies and gentlemen, in a couple of minutes, we will start roughly at 1:30. We will start the program. As you already have heard a little bit, the vaccination ethics, the topic is quite complex, multidimensional, and multi-level, and it cannot be properly addressed by focusing only on one aspect. As mentioned in the introduction in the booklet that you received, scientists, generally speaking, especially those in related specializations, virology, vaccines, epidemiology, they are quite proud of what they have achieved so far. Thousands, maybe millions of lives have been saved. There are statistics about this. So they think that vaccination is one of the great success stories in the history of modern medicine. But listening to scientists only will not solve everything. There are people who are hesitant and some even quite suspicious about vaccination. Something that many scientists find quite strange, that this can be the case with one of the most successful stories in modern medicine. But these concerns and suspicions and questions do exist, and they have to be dealt with by different specialists, ethicists, of course, religious scholars, to speak to the people who have religious commitment and to enrich the global moral discourse itself, social scientists, healthcare professionals, etc. Throughout the coming 3 days, we will address as many questions or issues as possible related to vaccination ethics from different perspectives. We try to do justice to this multidimensionality and complexity of the vaccination ethics. Unfortunately, we couldn't have everybody that we wanted to. So there are some colleagues that we invited, but unfortunately for different reasons they couldn't. Some are very busy, some they just had a new baby and they had to take care as fathers, as mothers, etc. So besides the COVID-19 difficulties, there were also some family issues. So we had to think of other specialists, etc. So they couldn't be with us, but we tried to have as interdisciplinary perspective as much as we can. And we are very happy that we could bring prominent specialists in their own fields. You already heard about Dr. Laith Abu Raddad, my colleague. Dr. Ray Joraidini will take over the lectures of today. I may be responsible for the program of tomorrow. And so today and tomorrow, it's a lecture for each speaker will have 1 hour. I told them in my invitation letter that they should feel free to organize this 1 hour, maybe 30 or 40 minutes lecture and the rest for question and answer. So students of the summer school can always raise their questions through the box here for Q&A. But we have also the third day, the panel, the expert panel. We will have a number of panelists who will talk about these issues, but in a more informal, open, and interactive way. So you will have more time to discuss more questions that you may collect after 2 days of lectures. So this will be more in the third day. We will make some conclusions about what we have heard throughout the 2 days and the lectures delivered therein. I will stop here. We just have a couple of minutes before starting the next session. I will give now the floor to my colleague, Professor Ray Joraidini, our professor in migration, human rights, and ethics. Dr. Ray? Are you available?
Yep. Thank you very much, Dr. Mohammed.
You're welcome. You're welcome. So just a couple of minutes. I think Dr. Laith is also ready. So it's up to you. Thank you so much.
Well, we could start a little bit early. That should not be a problem. So it's my great pleasure to moderate the session today. There are 3 papers, 3 presentations. And indeed, as Dr. Ghaly mentioned, each speaker will decide how long they're going to speak and how long they will leave for discussion afterwards. Each session is only 1 hour, so unfortunately there has not been any facilitation for separate discussion period following the presentation. So for those who wish to raise questions, please, you may do so in the Q&A box. Participants have that facility to them. Then those questions will be then read out to the speakers or to all the speakers as they present themselves. So without any further ado, if I might call on Dr. Laith Abu Raddad, a great pleasure, who is the Professor of Infectious Disease Epidemiology at Weill Cornell Medicine. He is also the Director of the WHO Collaborating Center for Disease Epidemiology Analytics on HIV/AIDS, sexually transmitted infections, and viral hepatitis. His presentation is entitled Understanding Vaccine Science in the Time of a Pandemic, and we very much look forward to your presentation. Please, the floor is yours.
Thank you very much, Ray, for the introduction. It's really a pleasure to be here, and thank you for the invitation. Okay, thank you very much. Yeah, good afternoon. Assalamu alaikum. So first, I just want to declare that I have no conflicts of interest in this presentation. So I will start with this picture of a Pakistani child. This child, as you can see from the picture, has had a hard life because he is one of the millions and millions of people who were victims of polio, one of the viruses that caused this actually condition in him. His life story also will continue to be hard for the rest of his life because he is unable to function as everyone else. So he's definitely not, his situation is not unique. Millions and millions and millions before him have had the same condition. But his condition is totally preventable now because we have had a vaccine that can prevent polio infection and such disease manifestations. And really all what we needed to do, it's very, very simple, is to drop a very small drop of liquid in his mouth. This is all what we needed to do. And this is, in fact, another Pakistani child who is lucky enough to have had this actually drop of liquid before getting exposed to polio. And as a consequence, she can dream of a tomorrow and a life free from polio. So this is just one example of how vaccination has been so tremendously impactful in human health. In fact, and very, very easily, all what we need to do is something very, very simple, and we prevent millions and millions of disease cases and deaths. In fact, by far, vaccination is the most successful medical intervention in human history. Nothing in medicine comes even close to how effective vaccinations have been. So here is another way of seeing it. This is life expectancy in the US over a century. In around 1900, so only 100 years ago, life expectancy was just over 40 years. However, 100 years later, it's actually at about 80 years. It doubled. Life expectancy in the US in 100 years, it actually doubled. This is really an enormous achievement. It's even more spectacular, by the way, in developing countries. For example, Qatar here, where life expectancy in many developing countries, it tripled. Imagine, tripled, threefold higher. This is, to a large part, is due actually to vaccinations. And why this happened? Because now every child born around the world get vaccinated against what we call childhood infections. These childhood infections are really nasty. They have been killing millions and millions of children of all times. In fact, over half of children historically used to die in childhood because of these infectious diseases. If you ask your great-great-grandmothers and so on, or you probably hear stories in the family, it was very common for half of the children to die before age 5. Unfortunately now, this is really beyond us because from the very moment that a child is born, they start being vaccinated to a long list of vaccines that are extremely efficacious, extremely safe, and then they don't have to face this destiny. And this really what created this hugely increased life expectancy worldwide. And it's really fascinating. Humanity has never been healthier than it is today. Never in our human history we have been healthier as we are today. Here is another way of looking at it. This figure here shows the survival curve for women for men and women in the United States. If we focus on women here, on white even females, so we will see that very much no actually white female die in childhood because of vaccination. This is really what vaccination did. It prevented all of those premature deaths due to infectious diseases. We sorted out a very, very big problem that was causing death and disease. And so we live longer and we live a healthy life. So for a white woman, for example, in the US, when she is born, if she's born, let's say today, she can expect with a likelihood exceeding 95%, that she will live more than 65 years old. It's really amazing achievement. Yeah, now for men, it's a bit lower because unfortunately they smoke, they drink, they have traffic accidents more often. So it's a bit lower, but still very, very good. So really what vaccines have done is to prevent premature deaths to infectious diseases. And this has been happening globally. Now, infectious diseases pose different ethical questions than other diseases. In fact, quite starkly different, and we'll touch into a couple of them today. But before so, I just want to introduce a couple of concepts from infectious disease epidemiology. And now I'm actually lucky. In the past, when I used to talk about these things, it was the first time they get exposed to them, but no longer. COVID-19 actually have made people so much aware about infectious diseases and how they are transmitted. So the first concept is the concept of basic reproduction number. This is a very important quantity that's associated with every infection. If we take influenza, some strains of influenza have a reproduction number of about 2. So what does this mean? It means every infection will lead to 2 new infections. So here is a cartoon to explain this. If we have somebody, let's say, come here into Qatar with influenza, this person is going to spread the infection to 2 more people. Each of these people will spread the infection to 2 more people. And these as well will do, and so on. And this is how epidemics spread. This is why they really spread very quickly, because each person spread to more people, and those more people spread to more people, and so on. So this is the case for an infection with a reproduction number of 2. If the reproduction number was only 0.5, however, there is only 50% chance that this person will spread the infection to 1 more person, and 50% chance he will not spread to anyone else. So the infection will die out. It will not be able really to spread. This brings us to what we call threshold theory in infectious disease epidemiology. For any infection to spread, the reproduction number has to be greater than 1. If it is below 1, the infection is going to die out. We don't really have to worry about it. It will start few chains of transmission, but it will die now. It will definitely die out. So this is the first concept. Now we go to a second very important concept, is the concept of herd immunity. Let's go back again to this strain of influenza with a reproduction number of 2. So this person comes into the population. He spread the infection to 2 more persons. These 2 more persons spread the infection to more and more people as well. Let me actually put the pointer here, spread to 2 more people. And then these 2 more people spread the infection spreads further and further and further. So we have a population where lots of people get exposed to the infection. The infection will not die out because the reproduction number is larger than 1. Now, what if we have a vaccine and we manage to vaccinate half of the population against this influenza strain, and so that they are protected and they cannot get infected? What will happen? Well, here is our population, half of it vaccinated. Those are the green circles, and the other half are unvaccinated. So this person enters with the influenza. He will pass the virus to 2 people because half of the population is vaccinated. It's most likely one of them will be vaccinated, so will not be affected, will not get the infection, will not be also spread the infection to other people. The other person will get the infection. So in reality, this infected person passed the infection only to 1 person instead of 2. Earlier, without vaccination, he was spreading the infection to 2 people. Now it's only 1 person. It means in reality that the reproduction number is not really 2 now, it's only 1. Each infection is causing only 1 more infection. We are exactly at the threshold of transmission. If we vaccinate more than 50% of the population, R0 will be less than 1, which means the infection will die out. This is really what defines herd immunity. Herd immunity is when we vaccinate enough people in the population that we make R0 lower than 1, and so the infection has no future in spreading. And based on the argument I presented just now, possibly someone may have guessed that this proportion of the population that needs to be vaccinated to prevent the infection from continuing to spread is given by 1 minus 1 over R0. This is a very famous equation in infectious disease epidemiology. So if we apply it here for influenza, where R0 was 2, 1 minus 1 over 2 gives us 50%. So we need to vaccinate 50% of the people. Anything higher than 50%, it's guaranteed we will prevent the infection from being sustained and we can control the epidemic. So this brings us to a question. What is R0 for COVID-19? So here is where more of a painful story. We started with an R0 between 2 to 3. So it's kind of similar to the cartoons I have just actually presented, which was for R0 equal 2. But now, unfortunately, with the Delta variant, this has now increased because the virus have been mutating and we reached an R0 of 8. Very, very high R0. So what does this mean? If we apply this equation, 1 minus 1 over R0 gives us 1 minus 1 over 8, which gives us 87.5%. We need to vaccinate at least 87.5% of the population in order to reach herd immunity. It's very, very high proportion of the population. It's different than the influenza example that I've just showed you. So we're talking about a very challenging infection to overcome. And this, of course, highlights how important is really vaccination. We really need to increase vaccine coverage to very, very high level in order to be able to have a solution with this pandemic. So if we don't reach that vaccine coverage, well, we are back to the cartoon I've just shown you earlier. The infection will keep spreading, because R0 is not yet below 1. That's it. There is really no other way out. This is what is going to happen, which brings us to actually a very simple fact and really painful fact. Maybe some people do not appreciate it. This pandemic will not stop till 87.5% of people are either vaccinated or infected, because when they get infected, they are like vaccinated. They will have the immunity. As long as we are below this threshold of vaccine coverage, the pandemic will continue. We cannot actually get out of this. So what does really this mean is that really there is really no choice here for any person. It's either we will be vaccinated or we will be infected. If someone thinks that they can avoid vaccination and they can avoid infection, this is really a very unlikely scenario. I can tell you the likelihood of this happening is only 12.5%. That's it. Very, very small likelihood. We cannot actually have continue without actually one of these two options. So this brings us to an important fact, is that herd immunity is really a need for society. In order for us to get out of the pandemic, we need to reach herd immunity. But this depends on cooperation of sufficient proportion of individuals in the society to be vaccinated. We cannot do that till really individuals actually wants to be vaccinated, and they get vaccinated, and we reach that level of herd immunity. It's quite actually a dilemma. This is, by the way, a classic example of fard kifaya in Islamic traditions, that sufficient proportion of the population has to do something in order for the rest not to have to do it. So it's really a very big ethical dilemma. How can we balance the right of each individual to vaccinate or not? This is eventually an individual choice, and it should remain as an individual choice, in my opinion, versus the right of society to reach herd immunity, to reach economic recovery, and to return to normal life. How we are going to actually balance this out? This is really a very important question. Now, but we can see how governments are increasingly thinking. Really, if you look globally, you'll see governments are going in a very specific direction. They want to preserve the right of unvaccinated to remain unvaccinated. It's really up to them. This is really the thinking for most governments. They don't want to make vaccination mandatory. They want to keep this option to the individual. And I think this is the right thing. We have really to protect civil liberties of everyone. At the same time, those unvaccinated are causing a lot of harm to their society. So governments are going to make them pay a price, a tax, so to speak, for the cost that they are causing to society for not being unvaccinated. This is really how it is. And this is why now we will see more and more privileges for vaccinated persons, less privileges for unvaccinated persons, and probably the cost to unvaccinated will increase because they are really causing a severe cost to society. Now, of course, here I'm talking about societies which already have the luxury to have the vaccines. We have a lot of societies globally that they don't even yet have the vaccines. But we have many countries where they do have the vaccine. It's really now just down to the unvaccinated to decide to vaccinate or not. So what are the costs of not being vaccinated to the rest of society? The first cost is that the infection will continue. So we will not go back to normal life. And that's, of course, heavy cost to the economies, to normal life, and so on. But also, by not being vaccinated and the infection continuing in the population, we are exposing the vulnerable segments of the society to the infection, to disease, and to death. And we do have significant proportion of the population, always, who are more vulnerable. So here we have people who cannot be vaccinated for a range of health conditions. We have people who are immunocompromised and immunosuppressed. So even if we vaccinate them, they do not have the same level of protection as other people because there is a problem with their immune system. We have the elderly population who are more prone to disease and death. And of course, we have children who are much less likely to die and to develop disease, but still, they don't yet have the option of being vaccinated so far. And it will take probably a few months before we will be able to vaccinate them. So during this time, they will be exposed to infection, and some of them will get the disease, and some of them may even end up dying. So by not being vaccinated, we are exposing all of those people to harm. And not only that, as we have seen, the more we allow this pandemic to continue, there is more likelihood for new variants to appear, new mutations to occur. So we will have more infectious and more severe COVID-19 variants. And this is, you have seen, we started with the original Wuhan type, then we had the Alpha variant, then we had the Beta, then we had the Gamma, and now we are really struggling with the Delta, is so much more infectious and is causing more severe disease. So we really need to get out of this. In reality, in many ways, that not being vaccinated is like a ticking bomb that is waiting to explode, because we have real dangers by allowing the pandemic to continue. So this brings us to a question. Can we achieve herd immunity for infection through vaccination? Now, for COVID-19, it's actually quite difficult. It is possible to reach some kind of herd immunity, but it's really challenging. And we've seen some of the challenges, one of which is that we need basically to vaccinate 90% of the population through highly efficacious vaccines. So for COVID, it's difficult, but there is a possibility. And we have lots of successes from the past that shows us this is actually possible. Here is probably the greatest success story of all time, smallpox. This infection used to cause lots of disease and death throughout human history. In fact, in the 20th century alone, it caused at least 300 deaths in the 20th century. We're talking just about the last century. But we had a vaccine for this, against this infection. In fact, it's the very first vaccine that we had as a humanity, and it's extremely efficacious. And eventually, globally, we managed to have enough people to be vaccinated. We reached herd immunity, sufficient proportion of population to be vaccinated, to the extent that we eradicated this infection completely. This happened in 1979, so not long time ago. And now we don't even have to worry about this killer, which has killed so many people. It's just very, very amazing intervention that wiped out an entire disease from actually of our threat. Imagine how fascinating is this. Here is a picture of two friends, one of them vaccinated, one of them unvaccinated. Both of them got exposed, but of course the unvaccinated was protected. Sorry, the unvaccinated was unprotected. And you see what happens, the vaccinated, it did not matter. So we solved this problem fundamentally for smallpox, that we don't even have to be vaccinated anymore. I get vaccinated because I was born before this infection was eradicated. But many of the audience actually were born after, and they don't have to be vaccinated. My children did not have to get vaccinated. And this is in fact one of the consequences, is that when we vaccinate at high coverage and eradicate an infection, we have much less vaccinations to be made in the future. So if we are so good at vaccination, we will have even to vaccinate less in the future. When we vaccinate well, we will vaccinate less. This is really the story, and this is what you have just seen for the case of smallpox. This brings also another question, which is, in my opinion, it's also an ethical question. So it's appropriate for this actually venue and this opportunity. Is it ethical that the smallpox vaccine was available for a long time, but it took humanity nearly 2 centuries, 200 years, to distribute it and to vaccinate enough people to reach herd immunity and eventually to eradicate it? Is this really acceptable? And during this time, hundreds of millions of people died. In my opinion, this is really unethical. We have to do things much better. Well, we did improve much better compared to this time, but we are no way close to where we want to be. So here is an example. This is for human papillomavirus. We do have a vaccine since 2006, so for 15 years now. This vaccine is extremely effective. It's actually 99% effective. And this virus causes cervical cancer among women, which is the second deadliest cancer after breast cancer among women. So with this vaccine, we can literally wipe out cervical cancer among women. Imagine the second leading cancer among women worldwide can be completely prevented by only vaccinating girls all over the world. But still, till now, most females in the world are not protected by the vaccine. This is really a dilemma, which happened also with other vaccines. Having the vaccine is one thing, but distributing it equally everywhere is another thing. And if we do not distribute it equally everywhere, we cannot reach herd immunity. Herd immunity means a global herd immunity in every country, in every society around the world. So we saw the success for smallpox. Could it be also we could have many other successes? Absolutely. In fact, we are getting very, very close. I will show 2 examples now. The first one is polio. This really should have been a success story even a while ago. We have an extremely efficacious vaccine. We already, in fact, eradicated type 2 of polio. We already eradicated type 3 of polio. This happened in one in 1999, one in 2012. What remains is only type 1, which is right now endemic, is in only 2 countries in the world. These are Pakistan and Afghanistan. The moment we reached herd immunity in these 2 countries, we are done. Mission accomplished, and we can actually dream of a tomorrow where polio is not even in something we have to worry about, just for smallpox. But it has been really challenging to reach herd immunity in these 2 countries, unfortunately, for complex reasons. But I hope we will be able to do so, inshallah. The other one is measles. This is a nasty infection. It used to cause 2.6 million deaths each year, but we have an extremely effective vaccine since 1963. And we have a global campaign to reach high herd immunity, to reach the high vaccine coverage so that we can reach herd immunity. We were progressing very, very steadily. You can see here the number of measles cases have been steadily declining year by year as we increase vaccine coverage. But unfortunately, in the last few years, we saw a reversal in the trend. It's actually increasing right now. Why it's increasing? Unfortunately, the anti-vaccine crowd have specifically targeted measles before they even targeted COVID vaccination, and with a lot of false information, such as it's linked to autism and so on, even though the scientific evidence is very conclusive. Lots of excellent studies have been done, and they refuted any link between measles and autism or any other condition. It's an extremely safe vaccine. Nonetheless, unfortunately, with the rise of social media, it has been really difficult to overcome misinformation, because now there are echo chambers where people don't really only hear themselves and people who think like themselves. It has been very difficult actually to overcome this. And as a result, there are people stopped getting vaccinated. And this is why we have measles outbreaks globally, including, in fact, in developed countries, which used to be in very, very good shape in terms of vaccine coverage. And the problem is getting worse right now. But this is definitely something we can do and eradicate this infection as well. So we have the vaccines today to eradicate many infections that have killed multitude of millions, only if these vaccines can be distributed globally. And we are running into this challenge with COVID-19. We are unable to have the right vaccine coverage because it's not yet available globally. It's available to some countries, rich countries, but unavailable to poorer countries. It's also, we are running into issues of vaccine hesitancy, as my colleagues just at the opening, they were talking about. So this brings us to a question which has been of much discussion in the COVID era. Are vaccines safe? Well, first, just a few things about vaccine biology. The first is that vaccines don't actually directly protect us against infection. It is our immune system that protects us against infection. This is a very important caveat. Really, all what vaccines do is we vaccinate someone, and when we do so, we are giving just a short training course to the person, to the immune system of this person, to prepare for itself, to defend it in case this person will get infected in the future. It's really very much just a short training course, just like the training course we are participating in today. That's all. It's our immune system that eventually protects us. That's it. It's just an opportunity, a small duration in which we train the immune system to do better. So this is why side effects are much less likely to occur as opposed to drugs. If, let's say, I have diabetes, I'm taking drugs every day, Well, these are chemicals. They can intervene in the chemistry and biology in different compartments of my body. And so there are more chances for side effects. But this is not the case for vaccines. Vaccines also are given as a one time. Usually, sometimes it's only one dose, sometimes 2 doses. Really, it's rare to have a vaccine where we have to keep vaccinating people regularly. And even if we do so, in worst case scenario, it's once every year. So how much we take of vaccine is really quite small compared to drugs where we take them every day. And we have a very basic relationship in science, not only in biology, but in physics, in economics, everything. We have what we call dose-response relationship. So what does this mean? If let's say there is a poison and it's bad poison, if I take very little of this poison, actually it's not going to harm me because it's so small, it's not going to harm me. If I take larger quantity, I will start having symptoms, but still I will not need to be hospitalized. I will not die. If I take a larger amount, I will have to be hospitalized. If I take yet another larger amount, I will die before even reaching the hospital because the dose is so high. So everything really is a question of dose. The larger it is, the more likelihood there are risks and side effects. Vaccines are very small dose interventions. We're talking about things we take very rarely. These are not drugs that we take every day and in continuous basis, which make them more safe. Also, another factor is that vaccines have a very short window of action. Why? Because really all what we are doing is training the immune system. There is a cycle in which the immune system gets trained. And this is maximum, it's about 8 weeks. This is based on thousands of studies, on thousands of vaccines for both humans and animals. We know if there are side effects, they are going to appear in the first 8 weeks. Why? Because this is exactly when the vaccine is acting. This is the time when the vaccine is training the immune system and how to protect itself against future infection. And this is why, by the way, in licensing any vaccine, and you have seen in the COVID vaccines, they cannot be licensed until we complete at least 2 months of follow-up among vaccinated people. Because this is definitely, if there is a side effect, this is when it's going to happen. Likelihood of long-term effects are very unlikely. It's really, really rare for any vaccine to cause any long-term effects because that's it. They act only during very specific time, this very short window, which makes them also less likely to have side effects. So the point I'm trying to reach here is that vaccines are naturally very safe and much safer than the other medical interventions. And we do develop the vaccines in a very rigorous process through clinical trials. And in particularly for vaccines, by the way, the clinical trials for them have the most stringent safety standard of all clinical trials with no comparison. And there is a reason for this, because we give vaccines to healthy individuals, not to patients. This is why we have very low tolerance for side effects. This is not the case for, let's say, a drug treating cancer. Over there, we have to balance because the drug may have lots of side effects, but still beneficial because we are treating cancer because the person is going to die from cancer, but not for vaccines because we are giving them to healthy individuals. Our tolerance for risk is very, very low. This is the highest stringent safety standard for any medical intervention. Another factor is that the safety of the individual is prioritized to the public health of the population. This is, by the way, it's frustrating for someone like me, who is a public health specialist, because we had very good vaccines we could not license because they may have some serious side effects in a small proportion of people. And actually then they were not licensed, even though if we license them, we will prevent more disease and more death because lots of, at a public health level. But it does not work this way. If the vaccine has to be proven to be safe at the individual level before we allow it to be licensed and to administer it. Even if there are lots of public health benefits to vaccination, but if it's not as safe enough at the individual level, it will not be licensed in the population. So we're talking about very, very rigorous process to ensure the safety of vaccines. And it does not really stop there. Because what we do, even after the vaccine is licensed, we continue to study them and look at their safety and look at their effectiveness. And if you go to the literature, you will find thousands and thousands of studies of what's called real-world vaccine effectiveness, safety and effectiveness studies, where we look for these things. This is also standard. This is part of what we do for very much every vaccine. So, of course, we have been doing this as well as in Qatar. So the moment we start vaccinating, we start looking into how effective are these vaccines. And for us, we were having the beta variant and the alpha variants circulating. So this allowed us even to see the effectiveness for these new variants, which were not available, which were not there when these vaccines were developed. And it was, and the results were very striking. It turns out the Pfizer vaccine was 90% effective against infection with the alpha variant, with the UK variant, and 75% effective against the beta variant that originally emerged in South Africa, which was the most concerning because it had the most immune evasive properties of all variants, in fact, more than even the Delta variant. So this study, we looked for safety, we looked for effectiveness here in Qatar after the clinical trials were done. And we found also that the effectiveness against hospitalization and death was 97%. It's even higher than the effectiveness against infection. So we're talking about very, very effective vaccines where anyone vaccinated with Pfizer, the likelihood of them developing severe disease is really, really small. And we looked even effectiveness after first dose, second dose, and so on. I'm not going to bore you with these results, but just to show you that we really do extensive look about how vaccines are working in the actual populations. We looked also at the effectiveness of the Moderna vaccine, which turned out to be even more effective than the Pfizer vaccine. So here are actually the results. Against the alpha variant, the effectiveness reaches essentially 100%. Very, very effective vaccine. Against the beta variants, it's actually above also 90%. Really, really good. Against severity, severe disease, it's essentially 100%. Really, really excellent working vaccine. This is, by the way, so far from our data and from global data, is actually the best vaccine, and Pfizer being the second. So just showing you how really it's such a rigorous process to show that the vaccines are actually safe with very limited side effects. But let's go now to something else, playing football. This is a very harmless thing. Everyone else probably did. I did it as a child, you know, a lot, in fact. Here are children doing it. But let's ask ourselves, does playing football carries side effects and risks? Well, it does. You have seen probably recently in the European Championship, one of the players, in fact, dropped exactly in the field while playing and almost lost his life while playing football. And I'm sure you have heard of examples in which people died in the field. You have heard of many also examples, and some even had injury while playing football, you know, breaking leg, breaking feet, breaking hand, etc. So this is an activity that has definitely side effects, but we accept these side effects. Why? Because the benefits of sports and the joy of playing football and so on are minimal compared to the risk, and side effects are minimal compared to the benefits. So society accepts this balance. And this is true, by the way, for everything we do. Everything we do very much has side effects and has risks. But if these are really rare, well, we have to live our life. We have to move on, so we accept them. So, however, in a lot of things we do in every day, these risks and side effects are very poorly quantified. I cannot tell you, in fact, what is really the risk of death with playing football, because it really needs to be rigorously estimated, which was never done. But this is not the case for vaccines. We do have lots of studies to tell us actually this. And what applies to football applies to everything else. Everything we play, everything we eat, everything when we drive to work every day, everything we do has risks and has side effects that are poorly quantified. And because they are poorly quantified, we get the impression that they have no side effects and they are harmless, but it's actually not true. Vaccines, however, we always put them under the lens because we study them so rigorously with so many studies. We find if there is a side effect, we definitely find it. This gives the impression to the public that somehow vaccines could actually be harmful to them, which is actually not true. Vaccines for sure are much less harmful. They are much safer than playing football. I have no doubt about that. If we do the epidemiologic study, we'll find that because I can see the risk of playing football. But this is not what happens in the public mind. People don't really think rationally about risks. They cannot really compare risk quantitatively to be able to reach a rational decision. Natural, saying natural. It turns out this is actually something faulty in our thinking. And this has been, by the way, extensively studied. In fact, it led to one Nobel Prize in economics for Daniel Kahneman, who were able to study how people really think and able to demonstrate that people, especially in relation to statistics, assessing risk, and so on, they tend to be irrational. Something like vaccines, because we study them so much, people tend to think, and we identify some rare, very rare side effects. People tend to think that there are harmful effects, even though they are extremely safe. For other things, which they do have serious side effects, actually simply people don't appreciate them and they think they are harmless. This is really just something about how we think of things. And this is really a great masterpiece, really, of a book talking about all of these issues. Now, let's also, as we finishing up here, put things in perspective. We are today children of luxury. We forgot the history of infectious diseases. Why? Because we have been enjoying the benefits of vaccination. We have had very healthy lives because all of these vaccines that we have taken in childhood and that prevented us from developing disease and death. But unfortunately, because we forgot this history, we now have people lost this perspective of appreciating how important are vaccines. We need really to go back to the history. So I suggested actually a reading, which is a book about the history of infectious diseases, but this is just one example. Any really textbook or any book in the history of infectious diseases will tell you the really shocking, tragic part of our human history. It's shocking what vaccines have done. No wars, no genocides, nothing even come close to what infectious diseases have done to us and what vaccines have done to protect us from these infections. Infectious diseases caused a very big, tragic part of our history, far, far worse than anything else. But now this is behind us. We do not see it. So we unfortunately tend to forget this. So here is just one example. To this end, when the Europeans discovered the Americas and they went to Americas, they brought their infectious diseases with them, including smallpox, which was really very, very bad over there because the Native Americans did not have the immunity like the rest of the people to these infectious diseases. They brought actually about 30 infectious diseases. And these infectious diseases start spreading in the Americas, and they killed eventually about 90 million people within just few decades. This is estimated to be 90% of the native populations of the Americas. Imagine 90 million people, 90% of the population of a whole continent were wiped out by infectious diseases because they did not have the immunities. If they, of course, had the vaccines, this would not actually have occurred. This is really how tragic are infectious diseases. And we have been now living in the last year and a half, or even now close to 2 years, just another reminder of how serious are infectious diseases. We are talking about millions of deaths. We are talking about millions of disease cases. We are talking about really shattering the very basics of our normal life, which can be prevented by vaccination. So fortunately still, COVID-19, because we are in a much better stage in our human history, we have been able to deal with it much better than we dealt with other infections in the past. But still, it has been very harmful. I mean, just economically, the International Monetary Fund estimates that at least the losses so far exceeded 15 trillion US dollars globally. Imagine how much economic hardships have happened because of this pandemic. And now we have the tools to move on, which are the vaccination. But we need to ensure that everyone globally has them equally, and we really to ensure that we reach the right coverage to be able to live with, to be able to get out of this pandemic. So these are just many of the issues that relate to vaccination and infectious diseases. And I just like to end with a note about the future. And we're talking here about a very bright future for vaccination. In fact, we are right now in what's called the golden age for vaccines. Why? Because vaccines were originally thought of, designed to fight infectious diseases. But what's happening right now, thanks to a lot of progress in science and technology, vaccines are having new lives of their own. They can be used to even fight other diseases, especially the messenger RNA vaccines like Pfizer and Moderna, which we have 2 examples. These are the most effective vaccines. They can be used. The same concept of vaccination can be used to fight other diseases. Let's take cancer as an example. It is now theoretically possible, and in fact, this is how even some of the companies were established for this purpose. Like Moderna, it wasn't established to fight COVID-19. It was established actually to treat things like cancer. It is possible right now to take a sample from the person, from the tumor, look at the DNA, and then design a vaccine for only one person. We will give this vaccine to this cancer patient. The vaccine will train the immune system to attack the cancer cells, the tumor, everywhere in the body. The immune system then attacks the cells. It kills them, and the person will recover from cancer. That's it. So it might be possible in the future, and scientists are working on this, to be able to train, to be able to treat cancer with actually a vaccine. It's as simple as that, just an injection. No chemotherapy, no radiation therapy, no surgical intervention. Imagine how revolutionary is something like this, to be able to treat a very bad disease with just an injection. So these things are not yet there, but they are definitely on the horizon. We can see how something like this could actually work out. And also, there are other really very important innovations. For example, vaccines could be used as vectors for targeted therapies. It may actually come a time when we don't have, let's say, to take a diabetes drug every day. We could actually use one injection, which could actually be enough for a whole year of treatment, very targeted treatment with less side effects, and then which of course will simplify our life much more. So all of these things are really just part of the future of vaccination, and how really vaccination may play even much more role in our future health than the great contribution that it has done throughout so far. So with this happy note, I just want to acknowledge all collaborators, our team, the funders of all of our work that made everything possible, and thank you very much for listening.
Thank you very much, Laith. That was a truly wonderful and enlightening presentation, and I thank you so much for that. We have currently 2 questions in the Q&A box that I will put to you. About the reproductive number. What determines an infectious disease's reproductive number? Is the way a pathogen is transmitted making it more or less infectious?
Yeah, there are the factors that determine how high is the reproduction number are first the contact rate. How often do we contact each other socially? I mean, this is for respiratory infections. So the more contacts we have, the higher is the reproduction number. This is why we do restrictions. We do lockdowns to reduce this social contact rate. All what we are doing is to reduce this reproduction number. The second factor that affects it is the transmission probability in one contact. This depends on the viral load. For example, the Delta variant, it appears to have 1,000 higher viral load, at least some studies, these are very initial studies, 1,000 more viral load than the original Wuhan type, which means someone who has the Delta, they have so much viral load, so it's easier for them to transmit the infection to other people. This raises the reproduction number. The third factor that determines R0 is the duration of infection. If I am infected, if the infection causes, let's say, a long-term infection, let's say a week or more, then it's more, the R0 is higher. If the infection has shorter duration of infection, like influenza, usually it's only 1 or 2 days. COVID-19, it appears to be about 3 to 4 days only. So this also determines how high is R0. So basically, it's the factors that relate to how people interact with each other socially, and factors that relates to the biology in terms of viral load and duration of infection.
Thank you. A question or a comment more so in relation to the example that you gave of the soccer players. It said early onset dementia has been reported as more common among soccer players, especially the ones who use their heads very often during the game. So there may be those sorts of the issues involved there. The case that you presented, I think, was also something about possible pre-existing heart problems.
Mm-hmm.
Another comment, thank you so much for the interesting lecture. I agree completely with the notion that we are children of a luxurious area or time. Our generation has no idea what the consequences can be of infectious diseases. Well, do you think that knowing the history of infectious diseases, without the explanation of the positive aspects of vaccines, is that going to convince people? I mean, this is the task, isn't it? Is to convince those who are hesitant or who are hostile towards vaccines. I mean, your presentation for me was most convincing, but is that going to be effective for those who are not convinced? Do you have any thoughts on that?
Well, it's clearly challenging, and I think in our modern life with social media and so on, we kind of lost control in terms of effective communication channels. People in social media, they are in echo chambers. They just hear themselves, rather than they really hear the information from the appropriate sources. So this definitely worries me actually a lot. I mean, it's really, really for me, very shocking how actually it's so effective to spread false information. So you have seen actually recently in the just last couple of weeks, this investigation, which looks how these misinformations are being spread. And it turned out there are 12 people, imagine just 12 people. Some of them, it turns out they have even financial interest in doing so. Some of them were actually making millions of dollars in profits, by spreading ignorance, and it's so effective. 12 people can spread so much misinformation and counteract all what we are trying to do to get out of this pandemic. It's really very, very worrying, to be honest with you. Now, at the same time, of course, humanity is always adapting. So we saw we had big problem in hesitancy in the US, but now that the Delta variant starts spreading, somehow we managed to convince more people that they need to get vaccinated, and now vaccination uptake is going up. So it's really challenging. But clearly, the more risk people see, the more likelihood that they will vaccinate. But it's a tough, really problem of how we are going actually to sort this out, especially for a virus for which we know now we really need basically a universal vaccine coverage in order to get out of it.
Yes. I mean, there was recently, there was a report today, in fact, of a famous radio presenter in the United States who was telling people not to get vaccinated, who just died of COVID and regretted and expressed his regret. So maybe those are the tragic circumstances that might change people's minds. The damage may be done already too late. One other question here, since vaccinated individuals can still catch COVID, how does this impact the herd threshold immunity? Is this factored in when calculating RO?
This is excellent question. So it definitely, of course, it gets factored in R0, which makes R0 a more complex equation. But it totally depends on how infectious are those vaccinated persons who get the infection. So now it's pretty clear that breakthrough infections are a reality. Actually, they have been studied extensively, including here as well in Qatar. But I can tell you they are less infectious than the original infections in unvaccinated persons. Probably no less than 50% less infectious. It depends also which vaccine. For example, for Moderna, they were very poorly infectious. For Pfizer, they were actually more infectious. Some of them were very, very infectious, those people. So this factor, unfortunately, will complicate further the control, because even if they are partially infectious, those vaccinated persons who get the infection, it means we need now higher vaccine coverage to reach herd immunity. Even there is another complicating factor here. It's quite possibly, and we start seeing now the first signs that the effects of vaccines against infection will decline over time, which means the efficacy we have seen of 90% and so is going to go down, which means now we need higher vaccine coverage to compensate also for this. We will need also eventually boosters, almost certainly. So this is also another part of the complicating equation that we are running into. Yeah, unfortunately, things can get quite complicated, but still, vaccination, our really biggest and most fundamental solution. It is possible, by the way, now, it is really possible that vaccines alone, even if we have the highest coverage possible, may not be enough to eradicate the problem. It's actually a real possibility. However, what will happen is that they will prevent still severe disease. So we will just live with this infection. It will become just like influenza, but it's not going to cause a lot of disease, because in all, by the way, studies so far, even when we have waning of immunity against infection, we do not have waning of immunity against severe disease. We actually haven't seen, and this is globally. Yeah, so they remain to be extremely efficacious against the likelihood of having severe disease and having to be hospitalized or dying from the infection.
If I could ask one last brief question. Qatar has a very high vaccine rate, pretty much close to the 90% that you were suggesting. Does that mean that you can have herd immunity within Qatar as a country, or must it be global?
Okay, so we can reach herd immunity in Qatar alone, but that does not mean, of course, we reach the global herd immunity, which is what we want. So let's take polio as an example. We are already in herd immunity in all countries around the world, only remaining 2 countries. But because we don't have herd immunity in these 2 countries, the virus will continue. So we all have to continue to vaccinate accordingly. The moment we reach herd immunity in these 2 countries, we reach it all over, the virus stops circulating, and then we don't have to worry. We don't even have to get vaccinated, which is what happened for smallpox.
Okay, thank you very much. My apologies to Yasmina. I think that your question is going to be answered in subsequent presentations. So thank you so much for Dr. Laith Abu Raddad for his presentation. We will now break for 15 minutes and return with the next presentation by Dr. Jeffrey Khan at 2:45. So 15 minutes break. Thank you very, very much. Thank you for your questions.
Thank you very much for having me.
Thank you.